Before handing over to the Regional Director, Dr. Hans Kluge, to make his opening statement, let me briefly introduce our panelists joining from Türkiye today, who are also ready to respond to your questions. From Adana in southern Turkey, we are joined by Dr. Batir Berdiklichev. He is the WHO's representative in Türkiye, and also in Adana, Dr. Flavio Salio, WHO's global network leader for the emergency medical teams. Thank you both so much for joining us. So without further delay, Regional Director, Dr. Kluge, you have the floor. Let me just fix the camera angle quickly. There you go.
Good morning, everyone. First and foremost, on behalf of all of us at the WHO Regional Office for Europe and our WHO country office in Turkey, I would like to reiterate our heartfelt condolences to the people of Turkey and Syria. Your suffering is immense, your grief profound. WHO stands with you in your hour of need and always. As of now, more than 31,000 people have lost their lives to the earthquakes in Turkey. The number of injured, almost 100,000 people. Across the border in northwest Syria, the death toll is nearly 5,000. And all of these figures will likely rise. We have at the same time been witnessing miraculous rescue efforts by teams of heroic Turkish responders working around the clock in a desperate race against time. We are inspired by them and draw strength from their efforts. Yesterday, they saved Mayre, a young girl living in Adıyaman, from the rubble of a block of flats. She had been trapped for 178 hours. At WHO, we have been urging all parties, government and civil society alike, to work together to ensure cross-border delivery of humanitarian aid between Turkey and Syria and within Syria itself. The needs are huge, increasing by the hour. Some 26 million people across both countries need humanitarian assistance. We, working with many partners, are supporting the massive humanitarian response to save lives, treat the injured, and crucially, help get the health system, particularly primary healthcare, back up and running. However daunting that seems at the present moment. Over the past week, we have dispatched 3 charter flights packed with emergency kits and medical supplies destined for both Syria and Turkey, enough to treat 400,000 people, as well as conduct 120,000 urgent surgeries, and more supplies are on the way. Second, we have deployed technical search teams to the disaster zone to conduct urgent public health needs assessment and support our existing field offices in the area. Third, we have initiated the deployment of emergency medical teams, and fourth, released $16 million from our contingency fund for emergencies to help people in need. Just over a week since this terrible tragedy, there are also growing concerns over emerging health issues linked to the cold weather, hygiene and sanitation, and the spread of infectious diseases, with vulnerable people especially at risk. We stand beside the Minister of Health, Dr. Fahrettin Koca, and the Turkish Ministry of Health, who report that critical vaccine supplies, including against tetanus and rabies, have been sent to the quake zone, and mobile pharmacies have begun operating. In Turkey, an estimated 1 million people have lost their homes and are living in temporary shelters. According to the Turkish authorities, an estimated 80,000 people are in hospital, placing a huge strain on the health system, itself badly damaged by the disaster. The World Health Organization has launched a $43 million appeal to support the earthquake response in Syria and Turkey. But I expect this to at least double over the coming days as we get a better assessment of the massive scale of this crisis and the needs. This money will be used to ensure access to the most vulnerable and hard-to-reach populations, to provide trauma care and post-trauma rehabilitation, to provide essential medicines and emergency kits to fill urgent healthcare gaps, to deliver vital mental and psychosocial support to the affected populations, and to ensure continuity of routine health services, especially for women, children, the elderly, and those with non-communicable diseases. We have initiated the largest deployment of emergency medical teams in the WHO region in our 75-year history. 22 emergency medical teams have arrived in Turkey so far. These specialized teams from 19 countries will integrate into Turkey's ongoing health response, providing critical emergency care. Their immediate priority will be to support the many hospitals and medical facilities that have been damaged, working particularly to deal with the high number of trauma patients and catastrophic injuries. Now is the time for the international community to show the same generosity that Turkey has shown to other nations globally over the years. The country is home to the largest refugee population in the world, 4.2 million people from neighboring Syria, many of whom have lost everything again. We are witnessing the worst natural disaster in the WHO European region for a century, and we are still learning about its magnitude. Its true cost is not known yet. Recovering and healing will take time and a phenomenal effort. But I can assure you that the WHO will remain steadfast alongside the people of Turkey and Syria for as long as it takes. Thank you.
Thank you very much, Regional Director, for those opening remarks. So without further ado, we will open the floor to questions for the Regional Director or our panelists in Turkey. If you'd like to ask a question, please raise your hand in the system and ask your question. Esmir, please, over to you. Please unmute yourself.
Hi, Banu. Thank you for giving me a floor. Director General, you mentioned diseases and what could come after all of this, especially with the health systems in danger in both countries, in Turkey and Syria. How worried you are about that situation, especially with the weather going to the warmer temperatures in the later part of this year, and how you will assist to both countries to deal with all these issues, especially in the cities which are most hardest hit by these earthquakes. Thank you, Banu.
Thank you. Ardi?
Thank you, Esmir. So the top priority remains on life-saving interventions, trauma care, emergency medical support, search and rescue, because still there are quite a number of aftershocks which you should be aware about. But as you say, that independent actually of the weather conditions, because water and sanitation facilities are also hit, we are increasing public health surveillance and have to be ready for communicable diseases outbreaks, and hence routine immunization comes into the picture as well.
Thank you very much, Regional Director. Perhaps Dr. Salio, Dr. Flavius Salio, maybe you have a little bit to add from the EMT perspective, the emergency medical team perspective, in dealing with some of these potential outbreaks.
Yes, thanks. I think we have done through our global call. So we request team capacity to peak, to basically take the first wave of trauma patients, and our regional director mentions. At the same time, obviously, we are expecting possible complications as a standard response to such kind of disaster in the next few weeks. And at the same time, as already mentioned, there'll be the scale up of primary healthcare services in way to ensure that essential health services are provided. And this is basically the strategy that's been adopted so far.
Thank you very much, Dr. Salia. We have a question in the chat, and I think I'll go to Dr. Batir for this one. What specific measures are being taken to tackle potential sanitation issues beyond monitoring and vaccination? So what sort of support might the WHO be providing to the Turkish authorities and indeed our own programmatic work to handle some of the sanitation issues?
Yes, thank you for the question. Indeed, severe damage to water and sanitation system, it's a great concern, and it increases the risk of waterborne diseases and outbreaks of communicable diseases. We at the country level work jointly under the UN country team mechanism, because this disaster requires comprehensive response, including water provision, protection, sanitation, food and shelter. So we coordinate with various line ministries through the UN mechanism. It's also beyond Ministry of Health. And of course, under the circumstances to prevent this outbreak of diseases, first, it's a provision of safe water, because in some places, provision of tap water was interrupted. So there is a supply of water, drinkable water, as a first. And of course, we are dealing with the health authorities to establish and strengthen surveillance system, because it's not only waterborne diseases, but also it's a seasonal influenza and COVID. And displaced people in a crowded communal settings also more exposed to a risk of outbreaks.
Thank you very much. Sir, let's take on the next question from Ivana Bozovic, RTS Serbia. Please ask your question. I think you're still muted, Ivana. There we go. Nope, we can't hear you. Try? No, I'm afraid we can't. Maybe type your question in the chat, if that's okay. In the meantime, I might go to some other questions that we have received from the media while we wait for Ivana's question in the chat. And maybe I might go to both Dr. Berdiklivich and Dr. Salio on this, because we've been getting questions on what some of the expected demands are on the health services, at this time, at this unprecedented time. How does the health system need to respond to this crisis? Maybe over to you first, Dr. Berdiklivich.
Yes, thank you very much. I have to say that first focus was on the life-saving supplies, delivering trauma and surgical kits, coordination of emergency medical teams' arrival to the country. However, the acute phase of the disaster is almost over. And of course, we have other health issues becoming more obvious. It's interruption of routine health services. We need now to focus on trauma rehabilitation and also looking at the primary health care, because after visiting several provinces, we see that it's hospital infrastructure, but also primary health care level severely affected by this earthquake. So a growing problem also surveillance, as we already talked about it, and the possibility of outbreaks. So what we are currently doing jointly with the Ministry of Health, we're conducting rapid needs assessment in the most affected areas to form and identify response plan with the support of partners and donors. Also to mention that growing problem would be, and already we can see that it's a traumatized population. So the need for psychological and mental health services would be increased in this regard. So it's a preliminary period before the reconstruction starts. to ensure uninterrupted health services provision and public health services. Thank you.
Many thanks, Batir. Flavio, would you anything to add?
Yeah, I think it's a question of capability and scalability as since the beginning. So I think in the future, what we are expecting is what Dr. Batir already presented. Primary care services as entry points, as a way, obviously, to ensure that the services are provided, and then increase in the level of coordination in which, in the way we're going to match the gaps, identify with available resources and capability in the field.
Many thanks, Flavio. So we'll take Ivana Bozovic's question, and Ivana has asked, what impact do you expect on mental health, and in terms of what you have noticed, what you've observed, and how can WHO help? Regional Director, will go to you first.
Yes, as a principle, Ivana, mental health conditions increase in all emergencies for obvious reasons, direct or indirect impact. Unfortunately, the earthquake in our region in Turkey and Syria is not the only emergency. Obviously, it's the biggest natural disaster in the century, but we see in the other emergencies as well the need to scale up mental health services, which are to be part of any assistance provided. Then, Banu, let's give the floor to our colleagues what they are observing on the field.
So, Batir, maybe you'd like to come in on some of the mental health impacts, expected mental health impacts, not just now in the short term, but in the months and potentially years ahead.
Of course, as we going out of the acute phase, the need for the psychological and mental health support would be only growing, and this disaster would have long-lasting effect on the population. People only now start realizing what happened to them after this shock period. Before the earthquake, we had a strong collaboration in the area of mental health services with the Ministry of Health, with the Ministry of Family and Social Affairs. What we can do, and the negotiating currently with the authorities, it's a trainer of counselors so that they can organize these services and reach population in the affected areas, but also there are many people who were displaced to other areas of Turkey, and they would also need to be reached with that services.
Many thanks for that. There's a question now here from Tracy on death tolls. I think this might also need, well, it could be to Flavio or Batir, but when it comes to the numbers we receive, how are they calculated? Who is reporting the death toll?
I may be not aware of the details of the national, but there is a national coordination mechanism where all information is collected, and those figures are announced on a daily basis, and actually you can see them in live TV channels.
Many thanks. So the next question here from Megan Ford. I think, Flavio, I might come to you because I think there's an element here of EMTs, and hopefully you can also tell us a little bit more about the EMT deployments. But Megan is asking, are nurses part of the emergency response teams, and how have nurses been supporting the response efforts, if at all? And then maybe a little bit about the EMTs that you are coordinating on the ground. Thank you.
Thanks. I mean, first of all, nurses are very critical functions in all the team and hospital. For sure, are integrated as part of the team together with specialized physicians and alliance and technical auxiliary medical staff. What we have seen today is obviously unprecedented as well movement of volunteers with the level of capacity to complement the facilities. Those facilities have been augmented, the capacity has been augmented through the deployment of emergency medical team. priority is being given at those teams that have the capacity to provide emergency care services, including surgeries, in the way clearly to augment the capacity of the local services. Local services, that is quite obvious, they feel a significant level of distraction. We notice obviously the fatigue on the workers, and then clearly the need as well to care for their relatives and family. So it is that's the reason why actually we call for a team with the stronger capacities to be located in the strategic location to complement the capacities of the hospital. And now we say in the second phase, looking more to those teams that will have the capacity to increase the primary care services as well.
Many thanks, Flavio. We have another question here on, do you already have full access to victims or survivors in Syria? Regional Director, would you like to take a stab at that one?
Sure. I would like to acknowledge that this is a joint effort with my colleague, the Regional Director of the Eastern Mediterranean region, Dr. Ahmed Al-Mandari, and his team, and our teams are working very closely together. The WHO's cross-border operations into Northwest Syria is based out of the WHO office in Gaziantep and supports a population of over 4.6 million people. Since the earthquake, WHO has shipped over 250 metric tons of medicines and supplies, and these included 7 trucks containing 74 metric tons of WHO emergency trauma kits, essential medicines and supplies, including materials received on the first charter flight from Dubai that crossed into Northwest Syria on the 11th of February, which are sufficient to provide 3.2 million treatment courses. The UN resumed its cross-border operation on 9 February, following 3 days of temporary disruption due to the damaged roads. And the second aid convoy since the earthquakes hit crossed from Turkey to Northwest Syria on the 10th of February with 14 trucks, and further convoys are planned.
Many thanks for that. If there's no further questions online, I'll take maybe one more question that we received in advance. Flavio, I think I'll come to you for this one. And it's about, a week in now, we are still hearing, remarkable stories of people being pulled from the rubble. But how likely is it now for search and rescue operations to, be successful?
I mean, search and rescue operations are still ongoing in certain areas. Vital, obviously, to continue looking for a possible victim under the rubble, and as well as increasing those services in the area where search and rescue operations are ongoing. At the same time, it's after the initial week of operations, we have seen a significant amount as well of medical evacuations has been conducted in terms of severely injured that have been clearly taken out of the rubble and then have been transferred immediately to their referral facilities. I think that's a level of coordination. It's impressive, I would say.
Many thanks for that, Flavio. And on that note, if there's no further questions online, I'm going to wrap the press briefing for today. I'd like to just give the floor one final time to the Regional Director.
Thank you, Manu. And on the last question, I just want to reiterate that it is absolutely critical to ensure access to healthcare for all those who need it, regardless of where they may be. And regarding Northwest Syria, we hope to find a solution to ensure a constant flow of supplies together with other UN partners, other international partners, civil society, and be able to reach all those in need. As the concluding remarks for this press briefing, once again, I would like to express my sincere condolences to all the affected communities in Turkey, in Syria, and express appreciation to the Minister of Health, Dr. Fahrettin Koca, and his team for his leadership and coordination with WHO and the international community 24/7. Thank you for joining. I wish all of you a strong health.
And thank you very much, members of the press. If you have any follow-ups, please do email us at eupress@who.int. As always, stay healthy. Take care. Bye-bye.